a scandal involving vaccines tainted with deadly avian flu virus, who chose Baxter head up efforts to produce a vaccine for the Mexican swine flu that has seemingly migrated into the US and Europe. Baxter has confirmed it is working with the World Health Organization on a potential vaccine for swine flu, reports the Chicago Tribune. Baxter has previously worked with governments all over the globe to develop and produce vaccines to protect against infectious disease or potential threats from bioterrorism. After 9/11, Baxter helped supply stockpiles of a smallpox vaccine, and in 2003 the company was contracted to develop a vaccine to combat the SARS virus. In 2006 the UK government announced plans designed to inoculate every person in the country with Baxter's vaccines in the event of a flu pandemic. Even though Czech newspapers immediately questioned whether the events were part of a conspiracy to deliberately provoke a pandemic, there was no in-depth investigation by WHO, resulting in recommendations for the tightening of standards or for charges at Baxter made public. Since the probability of mixing a live virus biological weapon with vaccine material by accident is virtually impossible, this leaves no other explanation than that the contamination was a deliberate attempt to weaponize the H5N1 virus and distribute it via conventional flu vaccines to the population, who would then infect others to a devastating degree as the disease went airborne. Baxter has put the safety of the entire human race at risk together with WHO, and now, that same company, Baxter, is seeking a sample of the potentially lethal never-before-seen form of swine, avian, human flu virus, and who has chosen it to develop a new vaccine, reaping billions in the process. Why should Baxter be entrusted with this task by WHO, when Baxter have already been proven to be at the very least criminally negligent, and at worst a prime suspect in attempting to carry off one of the most heinous crimes in the history of mankind, unless WHO is involved? So, under the guise of helping to coordinate the response to a pandemic, WHO is actually helping vaccine companies to develop and also release the pandemic viruses with impunity by providing funds, licenses and authority. Though Dr. Margaret Chan, the Director General of WHO, is technically a public servant and has the duty as part of her official capacity to act at all times in such a way as to safeguard the health of the world's population, there are grounds for believing WHO is abusing its administrative structures, personnel and services, actually misusing pandemic material and pandemic declarations to assist organizations, companies, government bodies or other entities intent on.
Yeah, and they're not responsible. Your wonderful Congress and senators decided that these drug companies are not financially responsible if their products hurt anybody. I mean, you can sue them and everything, but the taxpayer winds up paying out the compensation, and that has got to change. That should have never been. That isn't anyone looking out for the best of the public. Certainly that is pharmaceutical companies, vaccine companies first. Americans hope you don't die, and if you do, well, the other Americans' tax dollars will pay for it. That's what it amounts to.
'57. Unleashing a pandemic virus and then carrying through a mass vaccination program with contaminated material in order to gain political and economic advantages from mass murder. The World Health Organization, together with the UN, will be given authority over the U.S. in the event of a pandemic under a decree issued by President George Bush in 2005, when WHO sends such a declaration to President Obama. FEMA and the Department of Homeland Security, pandemic task forces, will be deployed according to my information. Each state governor will be notified that the provisions of the Model State Emergency Health Powers Act, MSEHPA, will be implemented. This means that all Americans must consent to mass vaccinations, or be guilty of a felony crime. The legal situation is that anyone who refuses the vaccine, or resists forced relocation to a prepared quarantine compound, can, legally, be shot and killed. Justified, deadly force. See http://www.forhealthfreedom.org/pub modelstate.html. On Friday, April 24th, following the swine flu scare in Mexico, who ordered officers to man the pandemic control room 24/7 for the first time and was reported to be about to declare a pandemic. The WHO Pandemic Control Room is designed to map and track the spread of a pandemic virus, and is thus equipped with supercomputers tied to all UN member governments' security forces. This control room is where any declarations of pandemic will originate from, who appeared to be ready to declare a pandemic prematurely as a pretext to rush through emergency laws and mass compulsory vaccination program with contaminated or faulty vaccine material that could result in death or injury to people, as happened in the mass swine flu vaccination program of 1976, who intentionally manipulated information on the swine flu outbreak to play up the danger of a pandemic in order to justify the declaration of a pandemic and the implementation of a mass vaccination program, while ignoring and suppressing information that indicates whose drastic response is not proportionate to the risk, especially the evidence that many people have recovered from the swine flu with just rest and hydration, whose assessment of the dangers of this swine flu was by far the most pessimistic, with the CDC recommending just customary precautions, who identified about 80 fatalities at a time when the Mexican government itself confirmed only 16 from this new flu strain. The new strain of the so-called swine flu appeared in Mexico and America simultaneously, and under mysterious circumstances, also indicating a deliberate, planned and coordinated release of the synthetic laboratory-engineered viruses, but who only began investigating the mysterious incident after the Australian virologist Adrian Gibbs said in an interview he thought the virus had come from a lab. It is whose a special duty, given this precedent in 1976, to make sure no mass vaccination program is implemented unless that causes injury to the general public is implemented under.
So you see what they've been doing over the last 10 years, since they were busted in 2009. They've been delivering this vaccine. So only, 800,000 people died across the globe. I'm not sure if that's the right figure. I know there was like 40 or 50 in Australia, about 40 or 50,000 in the U.S., so it was kind of like spread out. So it was building each and every year. I don't have the exact figures in front of me. You can check it. But X amount of people are dying from these flus every year. It's really from the vaccines, according to this report, and others. So, as you can see, over the 10 years, it keeps getting more deaths and more deaths and more deaths. So they'll be able to do that level 6 almost immediately. And this is very scary because they've already appointed people in certain towns to be some kind of vaccine police and point at you and say, well, you're sick and you're going to be quarantined. And from what I understand, that already passed in the Congress and Senate. I watched some video on it. I didn't have a chance to check it out, but I mean, if you have a half a brain, you can see that they're about to put the green light on mass vaccinations for depopulation. So we got to get cracking and stop this thing.
58. Whose auspices by who declaring a pandemic prematurely and without having adequate safeguards in place to ensure the high quality and safety of any vaccine material. However, who immediately contracted Baxter, the very same company that nearly triggered a pandemic by releasing 72 kilograms of live bird flu material in winter to produce huge amounts of vaccine for the mysterious swine flu. Again, it was the WHO Reference Center which provided Baxter with the particularly lethal wild-type bird flu virus that ended up contaminating ordinary human flu material and being distributed to 16 laboratories in Austria, the Czech Republic, Slovenia and Germany under a false label, so nearly sparking a bird flu pandemic this winter in the estimation of experts and the media. Virus mix-up by lab could have resulted in pandemic, the 6th of March 2009. http://timesoffindia.indiatimes.com/article shows/4230882.cms. In the Baxter case of this winter, there is therefore a clear, well-documented link between WHO and the release of pandemic bird flu material in Europe this winter. The WHO is, according to reports, conducting an investigation into Baxter and Avier's role in producing and distributing this material, but has so far not made public the results of its investigation or made recommendations in respect of stricter biosecurity rules for laboratories working with the highly pathogenic bird flu virus. Under the Biosafety 3 regulations, an accidental contamination of the deadly bird flu virus strain, WHO sent from its reference center to Baxter with a human flu is virtually impossible. WHO's failure to conduct a full and detailed investigation into the Baxter incident, and to make those findings public or to make clear recommendations as to how to prevent a repeat of this incident is not merely a failure to perform their duty as a public health body, but evidence of their role in covering up the real origin of the pandemic virus, specifically, in WHO's own reference center. I contend that WHO and Baxter and other vaccine companies are working together to deliberately trigger a pandemic with the aim of profiting from it by sealing in advance lucrative contracts to supply a vaccination. I contend that high offices in organizations such as the WHO have been annexed by criminal elements who are actually helping to further a criminal agenda of committing murder with the motive of robbery, albeit using covert bioweapons programs. Given the fact that this Baxter incident happened only a few weeks ago and WHO is involved in it, in as far as it supplied a lethal strain of the bird flu virus and b, is investigating the incident, it is surprising how quickly WHO gave Baxter a contract to work on the swine flu. Although many researchers and NGOs issued warnings that resurrecting this lethal Spanish flu virus was dangerous to the public, WHO has been one of the biggest supporters of continuing research into this bioengineered virus and into its antidotes, spending millions, if not billions, of taxpayers' dollars on researcher creation, and then on vaccination and prevention programs. Jeffrey K. Taubenberger of the Department of Molecular Pathology, Armed Forces Institute of Pathology into the bird flu virus and specifically his reconstruction of the deadly strain of the bird flu virus from the genetic material retrieved from victims of the Spanish flu pandemic of 1918-1919.
Gosh, I need to get out of this country.
59. It was only in the summer of 2008 that researchers published evidence that showed that the bird flu can mix with the human flu virus to produce a pandemic virus in a laboratory situation. That same